Hi guys, welcome back to my YouTube channel. So for those who don't know me, Grace Miria the Aren here, working and staying in the UK. So guys, just from work, I've just come in and literally just most people have been asking me, how can healthcare assistants, where are you healthcare assistants? This is your video guys. And even if you haven't trained for healthcare assistant guys, please make sure that you watch this video till the end because it's going to focus on you guys. Thank you for watching. For those who have subscribed, as usual, thank you so much. If you haven't subscribed, please make sure that you hit the subscription button and the notification bell so that next time when I upload, make sure that you watch my channel. Okay guys, let's get to the video. Okay, so guys, who is an HCA or a healthcare assistant? So healthcare assistant is basically an allied health worker who supports the work of the physician, nurses and other healthcare workers. Guys, what are the roles? The roles of an healthcare assistant: number one, it's basic nursing care, observation, the vital signs, taking the temperature, the blood, generally the vital signs of the patient, and also to assist patient in eating or maybe going to the toilet and doing all those stuffs, and also to help the patient do his or her personal hygiene, like for example washing the patient, turning the patient, just to prevent some pressure ulcers and all that guys. So it's basically all that. And healthcare assistants are very important people in the hospital. What are the qualifications? The qualifications of being a healthcare assistant guys: number one, I would just say that you don't need like entry requirements that you're going to require for you to study healthcare assistant, but all you're going to need is a healthcare assistant certificate before you're able to get a job in the UK, because that is one of the things that your employer is going to look at it guys. So you make sure you have to do the healthcare assistant course back in your country before you embark on this journey. And guys, even if you're other healthcare laboratory technicians like the pharmacists and all that, you can also become a healthcare assistant or a senior carer guys. The difference between a healthcare assistant and a senior carer is that a senior carer is someone who has basically done things related to health, like social care workers, like the lab technicians, the physiotherapists and all that. When they come here, they can become senior carers. But a healthcare assistant is, you can become a healthcare assistant without any medical background guys. It's very possible. Okay guys, the first thing that you're going to need in order to work in the UK, you need to be eligible to get a healthcare worker visa. And how are you going to be eligible to do that? Eligible to work in the UK, there is the UK government has set out some specific codes, occupational codes. You need to be in either of the codes for you to be able to get that visa. So for the healthcare assistant, it's 6141. And this 6141 code guys, you can also go to the government of UK website and there are the occupationals there. If you're a physiotherapist, if you're from any healthcare backgrounds, and even teachers and any like that you have skills in doing, you can go to the government of UK and you can see if you're eligible to get a visa. That is the first thing. Like I said, of course healthcare assistants are eligible to have the visa. The next thing you must have is a job offer. You have to have a job offer before you come into the UK. And how are you going to get this job offer guys? The first and foremost thing before you get a job offer guys, you need to have the right qualification. The second thing is that you have to have a job offer from an approved UK sponsor. An approved guys, not any sponsor. The sponsor that is going to sponsor you should be approved, and that they are going to give you a certificate of sponsorship at the end of this, which you're going to be able to apply with your visa guys. That is the second thing you need to keep. So guys, concerning this certificate of sponsorship, is just an electronic record. There's no physical like a physical paper. You're going to get an electronic record of it that has a reference number. This reference number is the one that the UK government will need in order for them to give you your visa. So guys, after the COS, there are these documents that you're going to need for you to apply your visa. And foremost, the first document that you're going to need is the COS, the certificate of sponsorship reference number. Like I said, it's going to have the reference number in which your sponsor will have to get from the UK government. So once you have your certificate of sponsorship, then the next thing that is your proof of English language, guys. You need to prove to the UK that you're able to speak, you're able to communicate in English. Generally through communication, you have to do your IELTS exam, guys, and make sure that you do the right IELTS exam before you start thinking of it's just not like all the IELTS that is going to be accepted for this healthcare assistant, guys. It's basically, if there's a specific IELTS that you're going to have to do, guys, this is going to be a story of another day. As for tonight, I just need to talk to you about the process, guys. So the third thing that you need to have is a valid passport. You got to have a valid passport or anything that shows your identity and basically it shows where you belong. That is the third thing, guys. So before you embark in this journey, because I know that there are some countries that this passport takes quite some time before it shows up, you can start this process you can start looking for your passport much earlier before you embark on this journey, guys. So the fourth thing is your job title and your annual salary. The job title, your job title is going to be a healthcare assistant or healthcare auxiliaries or sort of thing, and your annual salary. So your annual salary is expected to be approximately £20,480 per year before the UK actually gives you the visa, and so that you're able to come and work here. Your employer is able to pay you that kind of money that will enable to sustain you while you're here. So the next thing is you need to be in the occupational code. Like I said, the occupational code 6141 is the code that healthcare assistants are going to be coming in with. You'll need to have that code before anything. Thing is that you're going to need your employer and your sponsor license number. Most of these things are going to be in your certificate of sponsorship. So when you just present your certificate of sponsorship, you find that it has most of the things. So you'll not be required to be presenting each and every these details that I'm going to be mentioning, guys, because most of them in your certificate of sponsorship. So other things, basically you're going to need enough money to come here, because unless your employer is going to sponsor you, and even if your employer is going to sponsor you, guys, you're going to need some good amount of money for you to come here, because there's no way you're going to sleep hungry. You need to buy some clothes, you need to buy some basic things like soap and all that you're going to need, and your employer is not going to cater for that. You yourself are going to cater for that, guys. So you need to have money, and the UK government is going to consider that. Like in my case, in most cases like nurses, I'm not sure, but there are some healthcare assistant and nurses that their sponsor says that it's stated that in the certificate of sponsorship that it's your employer is going to cater for all your needs while you're here, but not basically all your needs, like most of it. Like the first 2 or 3 months, your employer then is going to take care of your accommodation and maybe transport. It depends. Other things like marriage certificate, just in case you're married and you're going to need your spouse and your children to come here, you're going to need that. And there are some other countries that require the TB certificate. You're going to need your TB test certificate for you to come here, guys. But it depends from which country you're from. Like in my country, you have to have it before they actually give you the visa. You have to have it. So just go onto the UK website. It will show you all the countries that don't require the TB test for them to come here in the UK, guys. Criminal record. You have to have the police clearance. This includes in all of the countries that you've been for at least more than 12 months, as far as I know. More than 12 months. If you've been to different countries for more than 12 months, you're going to need all the police clearances from all those countries before they actually give you your visa, guys. It's quite process, but at the end of it, it's all worth. All that I've mentioned is just the basic things, like things that you must have and you must do for you to get your visa. And guys, before you even think of your visa, you need to have your CV aligned. There's no way you're going to get a job offer without a good CV. CV alignment, guys, is something that it's going to present you as a whole, because you physically you're not there, but your CV will talk to your employers about you. So you need to make sure that your CV is aligned to be an international CV, not just the CV that you do in your countries, your basic CVs and all that. It should be an international CV that states basically your name, the country that you're from. It should have your contacts. At least it should have a photo of you just at the top of it. I'll try one day to make a video on the CV, but you need to make sure that your CV is aligned to an international level, so that when you send your CV to different employers, you're able to get your job as soon as possible. So once your CV is ready, it's well aligned, then you can start looking for your employers. Looking for your employers, it's quite demoralizing to some people, but guys, you know that you do it on your own by simply going to the to specific hospitals, to care homes, and try to send your CVs directly to the hospital. If you send directly, so that the hospital or the care home can consider you without any agencies involved. And the next other thing that you can do is looking for agencies. I know this is major question that most of the people have been asking. What agencies did you come in? What agencies did you come in? I'm going to be doing this in my part 2 of this, guys. I'm going to be telling you the agency that I came with, and some of the agencies that I think are good, and they are approved by the UK government for you to be able to come here. And most agencies are free, and it should be free actually. They are not allowed to charge you anything. So you can basically you can just go to the UK government and check for the agencies that are registered with the UK to sponsor you. Not all agencies are registered, and you might find yourself being conned, so you have to be smart. Just go there. In case you get an agency that wants to sponsor you, before you start any other thing, just go to the website of UK, and it will show you all the sponsors. Just type the name of the sponsor, and if that specific sponsor is registered to the UK or not. And if they are not registered, so please don't go with them, because they're going to con you. They are con men or con women. They're going to con you. So just be smart, follow the right process in order for you to come and work here, guys. So that I'm going to be doing a part 2 of this. Make sure you watch it. So guys, after you get your employer is when you're going to be doing all the other stuff that I've already mentioned about the documents, about the visa and all that. So guys, that's basically it, and see you on my next video, part 2 of this.